I'm Dr. Angie Stamm.
And I'm Kaela McGuire.
And this is Integrative Connections, a wellness community for pets and people.
Welcome to Integrative Connections. We are a wellness podcast for both pets and people. And today's episode is very special to my heart. We have Linda Beenau as a guest. She is the founder of Wonder Dog Rescue. And this is the rescue that I got my Shakti at 10 years ago. So Linda really stayed by my side through some hard times, but we got through it. And of course, we have our favorite holistic veterinarian, Dr. Angie, with us. So thank you for joining us.
Hi, Angie.
Thanks for meeting with us today, Linda.
Hi.
Hi. So I actually had the benefit of chatting with Linda a week or two ago and learning about her background in brachycephalic animal rescue, which was super interesting. Of course, I was connected to her from Kaela and her experience, which is great. So I would love for you, Linda, just to tell us a little bit about your background in brachycephalic rescue, how you got there, and why brachycephalics in particular.
Well, in 1990, I wanted a Boston Terrier. And people said, go to rescue. And I said, what's that? So I did go to rescue, and she wouldn't adopt me because I had a cat. And I ended up getting a puppy somewhere else, my first Boston Cosmo. And just a love of the breed, really. So I began helping this woman, Nancy Ford, who was in her 60s. And I began helping her a little here and there. So much of what I learned in the old days was from Nancy Ford. And this was before computers. You know, she had a Rolodex file. So,
nice. So you've been doing this a long time.
Yes, actually, this is my 35th year. So
Wow.
as things grew, as we started to get foster homes and more calls, we opened up to taking other small dogs. Boston's were my first priority for a long time, but we would take other small dogs. There were so many of them, especially Chihuahua mixes. But over the years, really, my biggest interest has been in senior dogs, in hospice dogs, and Boston's, and we're taking in a lot more Frenchies now than ever before. There are so many being turned into shelters or being abandoned on the streets.
Yeah,
And
I'm seeing that in my practice too.
They do have very particular issues, as you know.
Absolutely.
Yeah.
So are you seeing? Oh, go ahead, Kaela.
I said for a long time, at least a year, I'm going to rescue a Boston Terrier. And actually I said, I'm going to rescue a mellow Boston Terrier. And I got two very frequent responses to that. A, you can't rescue Boston Terriers because nobody gives them up. And second is Boston Terriers are not mellow. I was like, you me, I'm going to manifest this. And I will never forget, I actually still have this screenshot of your post of Shakti saying you have a month old. And so I came down and I met her, and I had no idea, how severe her issues were, but it was diet that healed her. And so that's so important to discuss today, because Dr. Angie really believes that the foundation of everything is diet, and so I love that you specialize in the small dogs, because I think that there are people who are more drawn to small versus big, and so there's a for everything.
Totally. Yeah. And with regard to the rescues, Linda, what are you seeing other than just stray dogs? What's the most common reason that you're seeing animals being surrendered for adoption?
Well, so many dogs are surrendered as strays. Even if somebody owns a dog, they're embarrassed to say that at the shelter, or they don't want to pay the relinquishment fee, which could be $25 or $50. So they'll say, oh, I found this dog on the street. The dog's licking their face, acting like you're my person. But the sad part about that, and I would encourage people, if you do have to surrender your dog, surrender it with the vet information, with the medical history. One small thing, if we don't have medical history, we have to redo all the vaccinations, especially rabies, and I'm not a fan of that. But I would say that, uh, a lot of it is behavior related. The consideration of natural diet and a natural lifestyle and method approach toward socializing and training a dog is important. So many people give up a dog because they haven't trained it and they've had fun with it, but now it's chewing the rug, it's chewing the furniture. A lot of people are having a baby and they're just freaked out about it. Um, but medically, I would say medically, it's dogs from breeders. So unneutered dogs, like a lot of females that will have mammary tumors,
Okay.
which may or may not be cancerous.
Yeah.
They're surrendered for medical problems in like in Boston Terriers, those older dog issues are congestive heart disease, of course, and Cushing's. That's what I find. And the really small Bostons, and here's another very important approach. A lot of those smaller Bostons develop brain tumors. I was told when I got Cosmo, the head of the SPCA in San Francisco examined him, and very nice, jovial fellow, and he told me that's the number one breed for brain tumors. Now, maybe Frenchies have taken over that spot, but how does one prevent, what nutritionally, what can one do to keep down inflammation or to help the dog to stay healthy and to not develop these issues? Yeah.
Yeah, we are seeing a lot of cancers, and I do see a lot of brain tumors and brain cysts in the Frenchies as well in my practice.
Mm-hmm.
Now,
Mm-hmm.
we don't always get the benefit of the advanced imaging. So
Exactly.
sometimes this is a presumptive diagnosis, right? But we do see, brain tumors in the brachycephalics across the spectrum, not just the Boston, for sure.
Is there a connection between brachycephalic and and a seizure disorder?
I do see more seizures in those breeds too. Um, I don't know what it is, if it's basically like a blood flow restriction issue causing more neuroinflammation, right? Because of the shape of their skull. That would
Mhm.
be my guess. Because they do have less space in there,
That's
right?
right.
So
The Boston Terriers in the 40s looked very different, and the earliest Boston Terriers really looked like pit bulls, but they've made that skull so much smaller now. That's the desired look, and I guess
yeah.
things don't fit in there.
Circling back to your rescue and I know you do a lot of fostering and you organize a lot of foster homes.
Mhm.
Um, I'm just curious, you know, when you're looking at foster homes, how can you can get a sense of whether it's going to be, um, you know, what qualities are you looking for when you're picking out foster homes for your rescues? And then do you look for people who are incorporating some of these more holistic approaches? Is that something that is beneficial?
I can answer that. That has changed over the years. It's at least in the Bay Area. And I suspect in other places, it's become much more difficult to get foster homes. People are distracted. I don't know what the issues are. In the old days, and even now, if I'm talking to a potential foster, I say, what are your deal breakers? Because I want to set it up to be successful. I want them to have a good first time and maybe they'll do it again. I don't want it to be a disaster because I've heard people say, oh, I fostered never again. So I want to know, what are your deal breakers? Is it barking? The dog's not housebroken, or dog's afraid of kids? And then I want to know, do you have children? Do you have a yard? Is it fenced? The same questions I would ask of an adopter, really. And when it comes to what I tell the foster homes is that we take care of the medical. Uh, and I'll tell them, don't spend any money that you want to be reimbursed for without checking with me first, because because sometimes that can backfire really badly. I would rather have someone call me at 2 a.m. because the dog's having a seizure than for them to, present me with a $1,200 bill. Just for a single seizure, I would, I wouldn't send them to an emergency vet unless it was a lengthy seizure. So
Sure.
really, I always consider that we're like the social workers for the dogs. I want to make the best match for the dog. First, it's the dog, then it's the people too. But so many people go by appearance. Oh, I love that dog. It's like, well, you don't know him. He might be afraid of men. And one of the things, I'm not living in the Bay Area right now because I went out to Hudson and started a kennel there and trained everyone in how to do rescue. And when I was finished with that, I stayed in New York State and that's just been since January of 2025. So it hasn't been that long. And I have family there and I'm enjoying that. But I don't get to put my hands on the dogs. I can look at a dog and think, belly, Cushing's, and I've learned so much from Dave Gordon, but he's not a holistic vet. He's not a holistic vet. And, but I love working with Dave and I've learned so much from him. But what I will do is research things. I don't know who the holistic vets are here in the Bay Area. I know some that do acupuncture. I've worked in a vet office. I've seen tremendous benefit from acupuncture and Chinese medicine. People might scoff at it, but that's a form of medicine that was practiced in China for thousands of years before it came over here. So
Yeah, it's proven and it's also very affordable.
yes,
Right.
yes, it is. Um,
How
uh,
often do the foster homes keep the babies?
I would say almost 50% of the time.
Really? Do you have a sense if that's going to happen before?
Not always. And I'll tell you something, though. Here's what I disliked about it. I'll play devil's advocate on myself, is that let's say that we get a 2-year-old female Boston Terrier. I probably, if I put her on the webpage, there could be 30 people that have applied for dogs and that want a female. They're Boston experience. They're great homes. But let's say you took that dog home to foster. I'd have to say to you, this is not a guarantee of adoption. But what really generally happens is when the dog has been there and the people say, oh, we want to adopt it, unless I still screen them then as an adopter, but they usually get to adopt the dog. So what's happened is that this started a few years ago, is that younger people, the tech savvy people, would kind of swoop in to get the dog they wanted. And then I started to say, well, the dog has to be on our webpage for a week before we accept any new applications. And they would just apply anyway. And it got to be a little frustrating. But the point is, if somebody, there was someone who adopted a dog about 1.5 years from us, and they got their first dog from us over 20 years ago. It's just such an honor to be in touch with them and have them come back. And especially the Boston people, breed people are true to their breed many times. So I mean, that's a difficulty because Bostons were extremely popular here, and the San Francisco Mission was one of the most popular zip codes in the nation. More young people yes, techies were moving here. But what happened is the people with a disposable income that want the designer dog, it's like, got it, and maybe another family that's just gotten over grieving their dog and trusts me to find them one. They never get a chance because of, just because of how it is. But I try to deal with that individually. And if a good dog comes in, it's been so many dogs, and I don't always have a memory. But if I can remember that there was that family, what was their name? And if I can, line them back up, I'll contact them.
Oh, I love that. Do you believe in soul contracts between dogs and humans?
Well, I will ask you to explain what that is.
Do you believe that dogs choose their humans, perhaps even before they are born into this body?
Ah, you know, I don't have an opinion on that.
Okay.
I don't have an opinion. However, I have very deep communication with dogs. I've listened to some of the more popular psychics, you know, that you'll see on television, Tyler Henry and what's up. There's another fellow that's really popular, and they attest to the fact that that animals come through when they're doing readings, and I fully believe it because I really believe I'm at a place where I understand that everything is energy. This candle is energy, my, you know, and that everything vibrates at different levels, and that our ability to understand and communicate is a little bit based on our ability to expand our consciousness, our opening to those different energetic levels. And
Oh, sorry.
no, that's
I remember when I came to rescue Shakti, you had another Boston who had chronic seizures, and you actually asked me to take that one as well because you had mentioned Shakti was a healer and would go sit by that dog when it was about to have a seizure. And so you felt that dog needed Shakti. And I couldn't take it because, to be completely transparent, I was already overwhelmed. I didn't think I had the capacity to have a dog who had seizures. Few years later, Shakti ended up having seizures for about the last 4 years of her life. And so I adapted, of course. You know, I was actually going to Dr. Angie, and a few of the doctors at her clinic helped me. But Shakti just helped me. I am a completely different person today solely because of adopting Shakti. And so that's why I asked the question, if you believe that that was contracted, because I fully believe it with no doubt.
I believe that believing is kind of a mental construct, and that these things happen on energetic levels. I just met a dog yesterday that I rescued while I was back in New York. I saw her. We do a lot of networking on Facebook, and I saw this dog popped up. It was a cute little Frenchie mix, and they said traumatic head injury, hit by a car, and I texted the shelter immediately. It's like, does she need rescue? And they said yes. So I didn't know what we were getting into. You know, the worst thing we're getting into is euthanasia. But we brought her to us and got her in to see good old Dr. Dave. And then she had some brain problems now, and then she began having seizures. And we don't know whether the seizures were a result of the accident or from or pre-existing. And I just met yesterday with the adopter and her mother, and the adopter was the foster, and I almost cried. It was so beautiful. This dog is she's so special. I almost brought her to New York. It was just adorable. But we talked about seizures, and they said, well, how long is it going to take before she'll want to play with a ball or be more interactive? And I said, well, it really depends on how she responds. She's on Keppra right now. So how she responds. And also, was that a brain injury? Is the inflammation receding? Will she have a complete recovery? Because after the seizure stopped with the medication, but then Dave noticed a paralysis on one side of her face. So there are so many little, things to consider. But I told them, I said, look, of all the conditions, I know more about seizures than anything else. You guys can call me at 2:00 in the morning if you need to. But I told them what to do. I said, I told them get the rectal Valium from the doctor. And then when I saw her yesterday, she said, we have that. Good. I said, is it in a bottle or in the syringe? It's in the syringe. But I've heard that it doesn't last as long in a plastic syringe as in a glass bottle. So I said, ask the vet, just when you see him again, tell him we've had these syringes for this amount of time. Do you think they're still good? That's where really the important people can do a lot on their own, but they have to be working with a vet because they need the best information. They really do. And you can't, so many people say, well, I looked it up on YouTube or on Google, and there's a lot there, but you need the one-on-one. That's my feeling.
Well, and I love that you're kind of an advocate and an intermediary between the vets and the foster or adoption parents, that you can kind of help guide them. And there's a lot of advice that you can give them directly because of your wealth of knowledge as well.
Yes, and to that end, I'm finding it harder. There are so many more dogs in shelters. It's getting harder to rescue dogs. You know, the costs have gone up. The adoption fee is $650, but that doesn't cover the neuter, you know, or the spay is even higher in the Bay Area. I can't speak to other places. And I've started a section on our page called Homegrown Wisdom. And I would love to share this video over there because I want homegrown wisdom to be something that outlives me, where, you know, here's how to photograph your dog. If I talk to people, I answer the phone all the time and say to them, network your dog this way on Facebook. They don't want to go to the shelter, and I can't take, there's no way we can take all of the dogs. But I can tell them, here's what we do. Here's how we find homes for the dogs. And they need that. They need that.
Can you share just a little tip of the iceberg about what you teach with that?
Well, sure. I'll ask them if they have Facebook. A lot of people don't, which I get totally. And I'll tell them that, you know, they'll say they posted on Nextdoor. It's like, it's not really, in my opinion, it's not really effective. Maybe in a rural area. But that Facebook, unlike Instagram, Facebook has a lot of groups that are dog related, or lost and found dogs, or dog rehoming, or animal rehoming, like 209 Animal Rescue. You know, all you have to do is go on Facebook, and I tell people, put in your zip code, or put in your area code, or, you know, Sacramento Boston Terrier Rescue. But you can also do Sacramento Lost and Found, and you it's not as appropriate, but you'll find other places and people will help you. And those same people that will help you, because these are the people who really love their animals, and they're very pro dog or pro cat, and so they're going to share your post, and it's going to be a lot easier. We've had the most success with using Facebook, to be
That's where I
honest.
found you.
And also, Pet Finder now has a way for individuals to post their own dogs, so that's pretty good. That's
Yes.
pretty good. Yeah, in the old days it used to be Craigslist, you know.
Right.
We would post when we wanted foster homes, we'd post them on Facebook or on Craigslist. And yeah, so much has changed. Doctor, do we have a few minutes to talk about something that's important to me me physically, and dogs, and that is the issue around inflammation.
Absolutely.
How to treat it, how
Again,
to avoid it.
Well, I think the number one strategy that I would do for pets, I'm certainly not a human doctor, so I can't speak to the human side, although I've certainly done my own research for myself, is of course going to be the diet, getting the carbs and the processed foods, processed carbs, and the unhealthy fats out of the diet. So you really want to focus on eliminating seed oils, vegetable oils, soy oil, canola oils. Those actually incorporate into your cell membrane and create instability, and it makes it more difficult for your cells to function. So you really want to focus on eating, you know, butter, whole, organic grass-fed butter, all good quality olive oil, tallow, ghee, those sorts of fats. Primarily. Avoid bottled salad dressings. I mean, I'm speaking for the human side, of course, but this is true in the dog side.
Oil.
Yeah, if you look at the ingredients on some of these veterinary diets, they have vegetable oil in them, which is really inflammatory.
Yeah.
They also put a lot of processed grains, in particular corn and wheat, in a lot of those diets. And those are high in glyphosate, Roundup. They're sprayed with Roundup before they're harvested. And they're also genetically modified, so they create a lot of gut inflammation. So really looking at, from a dog or cat perspective, getting them off of processed diets is number one, and getting them off excessive carbohydrates and getting them onto healthier fats. And that really looks like adding fresh meat, either one of these premixes that we talked about with fresh meat, and reducing or eliminating the kibble to the extent that they can, the owners can afford to do. I know it's more expensive to do that. Or going to a commercially balanced pasteurized raw diet. I am a proponent of those for many pets. It doesn't work for all pets. Or a lightly cooked fresh commercial diet that's balanced, lower in carbohydrates, and getting their weight down to an optimal range, or even a little leaner than you feel comfortable. Because really, body fat is the driver of inflammation. One of the other strategies that you can do that's free is intermittent fasting. So the worst thing you can do for a pet's inflammation is to leave a bowl of kibble out all the time and have them. That's like us snacking on potato chips all day and then stimulating insulin and driving that blood sugar up. So, it doesn't cost any money to feed your dog once a day instead of leaving out a bowl, and incorporate some fresh food in there and get their weight normalized. That's free. And so many people overfeed their animals out of love, treats constantly, always they feel guilty, so they leave that bowl of kibble out all the time because they don't want the dog to go hungry. Or even looking at fasting 1 day a week with water or broth or goat's milk. That really can reset the metabolism and allow the body to go through a detox. So
Very good idea.
very, very, it's free, it's safe, and makes a huge impact. I can tell you all these great supplements to give, but if you're feeding an inflammatory diet and your animal's overweight, we're not going to get anywhere, right?
Yeah. So, a couple of points, just a really quick question. Is flaxseed oil okay?
Flax is good. It has some health benefits, including lignans, which can lower cortisol. If you're using it for omega-3 purposes, however, the plant forms of omega-3 like flax and hemp are not very bioavailable in dogs and cats. They can't make the conversion to the utilizable form very efficiently. So you really need to use an animal, like a krill or a fish-based product, oil, if you're trying to look at getting their omega-3 levels up, which is really important for fighting cancer, fighting inflammation, joint inflammation, etc., skin diseases. So it's fine, but it's not going to be their most therapeutic form of omega-3 for dogs and cats.
I really appreciate what you're saying. It's so articulate and it's so knowledgeable.
Thank you.
And I want to add, and I agree with this for dogs, and this is in line with working with you or a doctor like you. I have a nurse practitioner as my PCP, and she will recommend herbs. Like I had high cholesterol and was taking statins, and I didn't really want to be on them for a long time, but now I'm on red yeast rice. And we'll redo my blood work to see how the cholesterol looks. But a regular doctor had never suggested that, and I have a specific liver formula. So instead of me going to a store and looking at all the bottles and, this one looks good,
I guess.
getting that information specifically from a doctor, the products. She told me about this Hepafam. It's a liver supplement to use, and she said get that one. And I don't question it. I've learned as much as I've learned by listening to people who know more than I do, and there is a real value in that.
Everything's so complicated now. Life's complicated now.
Gosh,
So my whole thing is how do I make shifts for my patients and their parent and their pet parents that are practical, easy, and maybe even things that they can both do, right? Like, for example, look at your water water filtration system. You and your pet are both getting affected by that, right? How can we improve that? That's a huge thing that people overlook, that are dumping chemicals and toxins into our bodies, right?
I have a dog at the vet today. I brought him in for neutering, but I held off on the neuter so that we could do palate reduction. And he's a Frenchie. Maybe he's got Bulldog in him. He came from the Santa Cruz shelter, and he was severely undernourished, malnourished, and he had terrible Demodex. So they said we can't neuter him until we get his skin cleared up. But the vet called me. I asked them, I remembered that earlier blood work, which was back in March, showed elevated liver enzymes, and that stood out to me. So I asked them this morning, like, can you recheck his blood? And my vet, who I've worked with for over 25 years, texted me and said he has elevated blood. So this is a question for you if you have ideas to speak on this. He does have elevated liver enzymes. Dave said we're going to do what is it, a bile test? He said it could be liver shunt that can be corrected with surgery. You can fix some types of problems. But Wally's just this happy-go-lucky sweetheart. I'm so happy he's my boy. He's the nicest little guy in the world, and so and no seizure problems. I mean, he doesn't act sick at all.
Sure.
So.
And how old is he?
Well, he's probably about 3.
Okay.
And he cannot take the heat. He can't take the heat at all. He can go around the block, and that's enough to put him in the early stage of heat, of a heat reaction where he can't stop panting. His gums will get red.
Sure.
And it's dangerous.
Yeah. So I think that definitely the soft palate reduction, I would say probably at least 50% of the brachycephalics that I see could benefit from the NARS surgery or soft palate reduction, because they have so much breathing issues and then they can't cool down properly, like you're seeing with him. The liver issue is probably unrelated, of course, and could be a number of things. Sometimes we don't find the true reason until we do an actual liver biopsy, which is a surgical procedure. So a lot of people don't go that far, but there could be a plumbing issue with the liver, like you say, a shunt or blood vessel, microvascular dysplasia is common, where the blood vessels to the liver aren't formed properly. They can have copper storage issues where they can't detoxify the copper from their bloodstream and it accumulates in the liver. And all of that, sometimes you do have to do more diagnostic testing, but if the liver values are mild, you can certainly do herbal support with things like milk thistle and SAMe and Chinese herbals and more anti-inflammatory diets, low copper diets, things like this, and kind of watch them. And if they're stable, then, and the dog's not clinical, sometimes they can live their whole life with these mild elevations, and you just support the liver and they can do well.
But would you do the surgery?
The brachycephalic surgery? It depends.
Yeah.
It depends how high they are.
Yes.
And maybe we don't know going backwards in time if they're rising or static, right? But if they're static, I probably just support him with some milk thistle and do the surgery. There's risk of leaving him, in a poor oxygen state.
Yeah.
Right.
Yeah. You bring up a good point, and I just want to mention this because so many people are fearful. They'll surrender dogs because they're fearful that they cannot afford the procedures or the trip to the vet. And I know that these things are expensive. It is for people too. But I also know, like, here's one little example. I know you can get Denamarin from the vet. When we bought it, I don't know, like maybe 10 years ago, it was about $50 for a box of 30. So I don't know what the cost is now. But I also knew, because I would look these things up, that you could treat with milk thistle. So I read the box and it was milk thistle and SAMe, I believe. I went to Scarlet Sage and I bought the milk thistle, I bought the herb, and I ground it down in my coffee grinder and was giving it to a dog, and he was improving. So, like, having the advice of a doctor like you, and then knowing that they can get the herbs from you, or they could go to a local store, knowing that people have options that might be more affordable to them,
Yeah.
that they could use in conjunction with the work they're doing with you. Because in the old days, there weren't many holistic vets. Um, there weren't many. And then I remember when acupuncture became popular. This was in California. Um, and then I remember when some laws changed and they said veterinarians had to be licensed in acupuncture and Chinese medicine in order to do this on animals. And it was just such a strange way of making things harder for them,
Yeah.
to offer that service. Now, can you tell me, for my own curiosity, do you do uh, what kind of services? Are you doing Chinese medicine, and are you doing the more traditional American herbs and such?
Yeah, we have an integrative practice in Folsom, California. It's full service, so we offer the full spectrum of traditional Western services, as well as traditional Chinese medicine and Western herbology, as well as
Okay.
nutrition.
Mhm.
So we use a lot. We have a couple of our doctors that are certified in Chinese medicine herbology, which is more of a specific constitutional diagnosis using the tongue and pulse and pattern symptomology. We offer acupuncture along with that. And then we also, I tend to use a lot of Western herbals too. I use a lot of MediHerb products, which is actually a human line that's distributed through Standard
Oh,
Process. And,
okay.
we use a lot of Standard Process products as well, which
Good
are
point.
whole food nutritional support that are, very broad spectrum and easy for vets and pet parents to
Mhm.
match to different symptomologies. They have a whole pet line, so they have a whole body support, they have a thyroid support, they have a liver support.
They have a liver support.
They do. They
Wally's
do.
about to be your
There's,
customer, your
yeah,
client.
and it's got milk thistle in it, but it has a lot of other whole foods and nutrients that
Yeah.
support the liver. So
Yeah.
that's really nice too. Yeah.
So as you were talking, the thought popped into my head was, gee, how much of this can you do? Do you need to do in person? Because I'm sure you do Zoom appointments with people
Mhm.
anywhere in the country, really.
Yeah,
Um,
for nutrition and some herbs we can do via Zoom without having an in-person appointment.
mhm.
If we are going to have to prescribe pharmaceuticals, or if it's more of a traditional Chinese medicine type of treatment, then we need to look at the patient in person. Uh,
Yes,
So we
yes.
have a lot of flexibility, and I do see some patients. As a matter of fact, I just had a call last week with a patient in New Jersey that's having some very bad allergy issues, and I was able to kind of help guide her on different testing and diets and things that she could try.
Yeah. Well, and another advantage to doing work with a doctor like you, from my own experience, my holistic guy years ago owned a pet store. I mean, this was, well, 20 years ago, probably 20, 25 years. And I had worked for him, and he carried a whole line of vitamins and such. And he said to me, the body knows best how to repair itself. And so if there was cancer or any kind of condition with a dog, he would say, use your essential fatty acids like fish oil or flaxseed oil, and vitamins A, C, and E. It's like,
Hmm.
great,
Hmm.
the antioxidant vitamins. But here's the thing, you can't just go to even a great pharmacy and buy vitamins A, C, and E and know how much of a dose. This was one of the things for me. I not too many vets had a formulation of this, and I would always caution people, like, these are good vitamins, but you want to find the correct proportion for your dog. So
Yeah.
those are the kinds of things that you carry. So if, for example, which I intend to do, if I came back and I said, let's talk about Wally. I'm
Mhm.
leaving next week to go back to New York State for a little while. You would, and I could tell other people, would you imagine that you would review his medical records and then talk about options. Is that?
Yeah, without having necessarily having to see him, we
Yeah.
could his blood work, we could talk about his history, and then I could suggest some supplements or herbals that you could purchase, you know.
Do you sell them?
Yeah, we can sell them to you, we could ship them to you,
That's
or I can
great.
tell you where to get them, you know,
Yeah.
either,
Yeah.
either way. And
Well,
potentially even talk about which commercial diets would be appropriate for
yes.
him.
That's another thing that's really important because,
Yeah.
you know, I hear people buy pedigree. Well, it's advertised, you know, pedigree, the food of champions at the dog shows. And I'm thinking, oh my gosh, not a very good food in my opinion. But
Same.
so much goes into advertising. But, you know, I remember Dr. Pitcairn had recipes for things in his book many years ago. And
Uh-huh.
and how do we find those diets? Would you recommend, like, uh, I read online that, you know, that the diet for a dog with liver disorder would be high, what was it, like low in protein, maybe it said high in copper or low in copper, I don't remember. But instead of just buying one of those formulated diets, what would you tell somebody in how to feed their dog?
I think in that scenario, I would look at doing either a home cooked diet that is lower in copper just in case there is a copper storage issue, because obviously you're not going to know that unless you do a liver biopsy.
Uh-huh.
Um, and I don't think that restricting protein, depending on, you know, unless he's in hepatic encephalopathy stages of liver failure, right, and actually
Mhm.
neurologic, then restricting protein is really not necessary. So,
Okay.
but because the liver and the gut are so closely connected, feeding a more anti-inflammatory diet is going to indirectly support the liver as well. So a fresh diet, less processed diet,
Mhm.
probably not kibble if you can afford to not do kibble. And there are a couple of food, you know, sort of prescription diets that are coming on board, lines that are formulated by veterinarians, holistic veterinarians that are specific for organ disease,
Mhm.
will be an alternative to your traditional veterinary prescription diets, which in my opinion can be more processed and maybe
Yeah.
not the most anti-inflammatory diets. Like, yes, they might have the right balance of nutrients that we're looking for, but really are they the best for the animal's long-term longevity and health and vitality? Maybe not, right? So,
And just a quick plug for a more generalized full balanced diet. We have a
Yeah.
webinar where Dr. Angie really breaks down a practical formula that you can
Oh,
incorporate into your pet's food. So shameless plug.
good. Thank
yeah.
you.
For
Thank
free. You
you.
can watch that.
There's
And
a
it's all focused on disease and cancer prevention as well.
Hmm. Hmm.
And there's, for example, there's one food line called Medicus, Medicus, which is a freeze-dried fresh diet, but it's
Hmm.
pantry, you know, ready. No, it doesn't require freezer space. That is
Hmm.
anti-inflammatory, very simple. And they have a GI, you know, sensitive stomach one. They have a kidney one. There's a cancer support. So, that's a great one for people who are looking for alternatives to the prescription diets that the
Hmm.
veterinarians typically carry.
Yeah.
Also Darwin's Pet Food, which is out of the Pacific Northwest. They're a direct to consumer frozen fresh food company. And they have a couple of prescription formulas. There's a liver diet, a kidney diet, a cancer
Mhm.
diet, a joint diet. And
Mhm.
that would be a great one for your dog to look at as well.
Mhm. Okay. And
Not
you could
one,
also suggest recipes for
yeah,
preparing for creating a diet. Yeah. A lot of
yeah,
people do that. They think it's better. But, you know, here's another point. Somebody says, "Oh no, I give my dog chicken every night. I don't buy that dog food." And I'll tell them, "Well, your dog's not getting all the nutrition it needs
right.
from you cooking a chicken breast or whatever." That
It's going
you
to be
know
very efficient in minerals and vitamins.
Do you recommend supplements to add to those all meat diets to make them more complete, or do
Yeah,
you
it's a
not
common
recommend them?
question. It's a common question because a lot of our clients who are more holistically focused do want to do home cooked diets, but they don't want the stress of having it, perfectly balanced, or they want to make sure that that's balanced.
Mhm.
Not a huge recipe person because I feel like the diet should have variety over time. A
Yeah.
recipe might look balanced on paper, but it doesn't account for bioavailability of, particularly if you're using the synthetic vitamins. So I worry a little bit if you're just feeding one mono diet that it could still have imbalances. So I like to encourage variety feeding if people are open to that, rotating proteins, rotating
Yes.
vegetables. And
Yeah.
there are a couple of really great commercial what I call premixes products that will balance your meat basically. One's called No Better, KNOW, No Better.
Ah,
They're out of Canada, but you can buy from their website. And you basically just add that to your meat and veggies, meat and or meat and veggies, and
mhm.
have it essentially the roughly right balance of minerals and vitamins and nutrients. The other ones I really like are the Dr. Harvey's base mixes.
Oh, I've been hearing about him.
Yeah, those are dehydrated vegetable bases that have nutrient superfoods, vitamins, and minerals added. And then you literally soak them in water. It's kind of like camping food. You reconstitute the vegetables, and then you add your protein and possibly some additional healthy fats like fish oil. And then you've got essentially a balanced diet. So that's an easy way for people to do more of a homemade diet without having the stress of getting it perfect.
Mhm. The questions are just popping up in my head. Like as soon as you said fish oil, I began to think about how I recommend to get it refrigerated or get it as fresh
Mhm.
as possible. Something that's transported in a truck any distance is in the heat. I know flax oil can begin to break down at, what is it, 134 degrees or something like that. My holistic guy told me that years and years ago. Um,
Yeah, I love Nordic Naturals. I've been using them a long time.
okay.
I typically recommend getting the liquid omega-3 PET or the cod liver oil, depending. You mentioned vitamins A and D. Cod liver oil has naturally occurring A and D in it in a bio form.
Ah.
So that's kind of a nice way to do it. Then you're getting your omegas, your A and your D. So especially
Mhm.
for cancer support, I like that. I like the cod liver oil a lot. And I like,
That's fabulous.
yeah, Nordic and Carlson are two of the top brands for that.
Okay.
Um,
Here's a maybe a more sensitive question. I have friends, I don't eat any meat, and I have friends that are pretty staunch vegans, and they feed their dogs a vegan diet. Do you have an opinion on that?
I do. I'm not a fan. I've had certainly some vegan patients over the years, and I don't think that the dogs thrive on those. They're typically very processed kibbles that are high in legumes, which have a lot of anti-nutrients and can block absorption of other
Oh,
vitamins.
really?
Yeah. So, and very high in carbs as well. So I think that the body, especially carnivorous omnivores like dogs, really do need a certain level of protein to thrive and do well.
Yeah.
I don't think that dogs are meant to be carnivores or to be vegans. And cats just plain can't. They need
Mhm.
they need the meat. So
Yeah.
um, if you are really opposed to feeding meat, then maybe get a rabbit or a guinea pig or
Mhm.
something that you can feed grass,
Yeah. Yeah.
right?
Yeah. Yeah.
I mean, because it's not biologically appropriate. It's like taking your horse and giving it steak, right?
Yeah.
Circling back, wrapping up in terms of your final thoughts and messages to the listeners who might be interested in rescuing, what would be some of your best advice? What would be your top advice for people who want to get into the rescue space?
That want to become
Or
a rescue or
yeah, start
adopt a
start
rescue?
getting into rescue or fostering, or what are the best resources, or should they just
I think if
work
you,
with you guys?
yeah, I think if you want to explore rescue, and the question I read and hear the most is, can you make money doing rescue? And um, and it's almost a moot point, because sure, you can, after many years or after a number of years or after a certain, a certain kind of audience that in support of your work, uh, I would tell that person, volunteer with a rescue, a good one. That's where you'll learn. I've taught people how to do it, and they've opened their own rescues. Um, and otherwise, and the same with, people will say, I lost my dog, I'm not sure if I'm ready. It's like, well, consider fostering. It's not a carved in stone, it's just a way to test the waters. But the biggest thing, we just had a dog like this, needed a foster home. The woman was moving, 10-pound multi-poo fuzz bucket, took him, and a woman said, I'll foster him, and got him over there. And the dog was a Cujo. He was snarling. He wouldn't come out of his crate. The woman said, my 5-year-old's afraid of him. I mean, this isn't what I was expecting. And I thought, well, we're going to have to move the dog. And I said, maybe the relinquishing party didn't tell us everything, but maybe the dog is freaked out. When you move an animal into a new environment, they have no idea where they are. It just, everything has changed. And you give that dog space and room and compassion to just decompress. And sure enough, I told the woman it might be that. And we had a video this morning, oh, he's friendly now. He's following us. He's good with my daughter, just because they gave him the space. The point is that you just, respect where they are at. People will adopt a dog. It's like, oh, I'm going to take him to the beach. We're going to a barbecue tomorrow. It's like, no, let the dog be at home. Let him learn his new home. So it comes down to giving oneself an opportunity to relearn compassion and patience, and finding that inside themselves, which is part of the healing process for humans as well, especially during these times.
I love that.
Yeah.
Awesome. Thanks, Linda. It was
so
great.
much.
It was so great chatting with you. You're such a
Thank
wealth of
you.
information. If you ever need a resource for your foster families, just let me know.
I certainly will. And that's specifically why I asked about you working, from
Remotely.
and actually it would be me, because since I'm the one paying the bills, I'm serious. If somebody goes to the vet, it's like, the vet says, should we do blood work? They're like, yeah, sure. It's like, no, we don't do blood work on 6-month-old dogs. Or you know what I mean? And that's why I say, don't incur any expenses unless I approve it in advance. And because I want to talk to the vets, and I know more than most of the people know. Not that I'm a whiz kid or anything, but when I can talk to the vet, I understand what they're saying, and I can make decisions on how to proceed. And I'm really excited to work with you more, Angie. I think that your knowledge, I love holistic. I love holistic. I have a wonderful book at home on aromatherapy for pets. It's a British book. And I found it at Scarlet Sage, which is now gone. But I mean, these are such magical resources that we have, and you are too. Thank you very much.
Lots of tools in the toolbox.
Lots of tools in your toy box.
Yeah. All right. Well, thank you, Linda.
I will definitely be coming back for my next rescue when I'm ready.
All right. And you and I will talk about those links about getting the information.
Yes.
Okay, super. Thank you so much.
Thank you, Linda.
Have a great day, ladies.
Dr. Angie. All
Bye.
right. Have a great day. Thanks for joining us.